My name is Jill Stevens, and I will be discussing the disease formerly known as monkeypox and is now referred to as Mpox. It was originally named monkeypox because it was first witnessed in macaque monkeys. The name was changed for a few reasons: to reduce stigma, racism, and homophobic remarks. Mpox is a virus, which is an infectious microbe. The scientific name, orthopox virus, monkeypox virus, MPV. It has a double-stranded DNA genome, which means it has a double-stranded polynucleotide chain, and the nitrogen bases are connected via hydrogen bonds. It is in the Poxviridae family, the Cordopoxvirinae family, the orthopox virus family, and then finally it is the Mpox virus on the table. The Mpox virus is 200 to 250 nanometers in size. It is brick-shaped and enveloped, meaning the outermost layer is a lipid membrane where it wraps around the virus. It is slightly pleomorphic and has a dumbbell-shaped core with lateral bodies as illustrated through this picture. It has a linear double-stranded DNA. The pox virus genome is about 200 kilobases in size and encodes for about 200 proteins. There are two clades of this virus. The first clade is a Central African Congo Basin clade and is native to Central Africa and is known as to be a more severe illness and with more deaths. The survival rate is only 90% according to the CDC. The second clade is the West African clade and is known for the global outbreak that began in 2022. It is less severe and has a 99.9% chance of survival rate according to the CDC. A viral core is created by combining DNA of EV and MV. DNA is copied and turned into RNA. Cephalidopaphyr produces brensodopaphyr to block DNA polymerase from replicating. Again, DNA is copied and turned into RNA. Morphogenesis develops shape. MV stay in the cytoplasm until released through lysis or tecovirimat targets a protein that is used to turn MV into EV. This prevents the virus from spreading throughout the body. An extra envelope is put onto MV, creating EV. It attaches through the cell membrane and is released through exocytosis. The first case of Mpox was found in research monkeys in 1958. It was first discovered in humans in the Democratic Republic of Congo in 1970. There was a multi-country outbreak in May of 2022 that occurred from human-to-human contact. The spread has become more global, with more than 111 non-endemic countries reporting about 92,590 Mpox cases by the end of December 2023, with a total of 118 countries and 95,340 confirmed cases. The disease has resurfaced with serious dermatologic, respiratory, and neurological manifestations in immune-compromised populations. The first U.S. case occurred in 2003 when humans extracted the virus from pet prairie dogs that were in contact with Mpox-infected rodents that were imported from Ghana. Out of 2,891 U.S. Mpox cases, they found that 99% occurred in men, 94% of whom reported male-to-male sexual contact. A total of 32,063 U.S. Mpox cases were reported by the end of December 2023. Out of those who tested positive for Mpox, 32.18% were African American, 31% were Hispanic, 29.75% were white, and 7.04% were affected. Public health Mpox prevention efforts, including vaccination, should continue to prioritize gay, bisexual, and other men who have sex with men, African American, Hispanic, and white persons, and persons who are immunocompromised. Mpox can be transmitted from infected human to human or infected animal to human, which makes it a zoonotic disease. Animal to human transmission can occur through bites or scratches, blood or bodily fluids from infected animals, and from hunting, cooking, and consuming infected meats. Human to human transmission can occur through respiratory droplets, contaminated surfaces, and mucosal lesions. The virus can enter the body through the skin or mucosal membranes or by sexual contact, which has the highest rate of transmission. During the inoculation period of the virus, it is not contagious, but during the prodromal stage, it is. Mpox begins with flu-like symptoms, including fever, headache, chills, exhaustion, asthenia, lymph node swelling, back pain, and muscle aches. A rash will appear in about 3 days, which will then develop into lesions. These lesions spread out from the site of infection. These lesions are commonly found on the palms of the hand and soles of the feet. Extremely large number of lesions occur when the infection is severe. Monkeypox can be fatal. The biggest difference between monkeypox and smallpox is swelling of the lymph nodes. Symptoms may last 2 to 4 weeks. Avoid contact with infected humans and animals. Practice good hygiene like washing hands. Genius vaccine that is used to treat smallpox that has been shown to decrease the number of Mpox cases, and it is 85% effective. There's no antiviral medication or treatment. If you're infected, see a doctor. There's no cure, but they will treat your symptoms. Monkeypox is less contagious and less dangerous than COVID-19. Thank you for watching my presentation on Mpox.